Hello and happy Wednesday. My name is Carmen. I am a myofunctional therapist and I call myself your educator extraordinaire because I am here all the time helping educate on all things myofunctional therapy. So what are we going to be talking about today? I am talking about something I've been thinking about and evaluating for the last few months here, and that is what my customers are most afraid of. And I know that sounds kind of weird, but I find that many of you have these two big things. So the first one is taking that step to get started. So I'm going to unpack that a little bit. And then the next one is being afraid to make a mistake. And that's a biggie too. So let's just jump right in. So first, let's talk about taking the step, that one step to get started, being afraid to do that. So there's three things really I kind of want to talk about there. Understanding the impairment. So for many of people who become my clients and those people who are afraid to just get going, understanding their impairment is frightening because they might be a member of like a Facebook group, something like that, where they're learning all of this stuff. And they're just like, oh my God, so much is going wrong that I don't know what to do. So that's why I encourage people to first understand what the concern is. Now, with that said, I have a lot of people that will give me, a list this long of concerns that they have or symptoms. I always say it's important that we understand the impairment and not talk about this whole laundry list of symptoms, because that makes us as therapists, or that would make me as a therapist, start to sound like I'm selling unicorn dust. So, there's always 4 goals that I work towards when I work with a client, and having somebody understand their impairment. How does this connect to this? How does A connect to B? That is going to be helpful. Many people come to me and they say, hey, do I have a tongue tie? And if you've been following me for any amount of time, you know that I always say, it's all about the myofunctional impairment. It's not about how it looks. It's about function. It's not, some people are very obvious. I get that, but it's about how the functional impairment is affected. And that helps paint the picture, if you will, of the impairment. The next thing that people are afraid to get started is they just don't know what the bare bones, what I call the bare bones of what to do. So they can add other things, but a lot of people, and you could ask 10 different therapists, doctors, specialists, whatever, and you are going to get probably 10 different answers. And this is where I find a lot of people who become my clients are paralyzed because they don't know if they have to do all of these things. So what I call the bare bones, I always talk with people about what they need to do at a minimum. And for me, in my practice, that is, if you have a tongue tie, you have to have a frenectomy. Most of the time. Now I say most, and that's bold capital letters, because many of my clients who do not have severe restriction, they have a myofunctional impairment snapshot this big. So they've got a lot of things going wrong. And so it's important that if we don't do the frenectomy, then they cannot, we cannot retrain the muscles. We cannot improve the function. And so that's overall the most important thing that I teach people is if muscles are not retrained, then the function cannot be improved. So that's one thing. So I always say that is a foundational therapy. Myofunctional therapy is a foundational therapy because you cannot successfully rehabilitate the oral structures if you do not do it properly. Now, there's a lot of other body works, adjunctive therapies, all of that kind of stuff. And that's what sometimes paralyzes people. They're too afraid to make a decision to get started because they just don't know if they need all of these things. So I tell my clients, bare bones, if you have a tongue tie, you have to have a frenectomy done. If you are so narrow that you cannot get your tongue to the roof of your mouth, then you need to consider expansion. Many people around the world come to me and they say, Carmen, I'm 55 years old. I don't know that I am going to do expansion, but I want to get my frenectomy done. Can you help me? Absolutely. And so that's where it's hard. Or I have a client come to me and say, well, my doctor wants to do expansion and straighten my teeth and do all of these different things. I don't have the funds to do that. I just don't have the means. Is it worth having my frenectomy taken care of and doing myofunctional therapy? And the answer is yes, because something is certainly better than nothing. Now, with that said, if somebody has an airway crisis, if they have sleep disordered breathing, those type of things, and they don't want to do a CPAP, they need expansion. They need something, but there is not just a catch-all for everybody, if that makes sense. Okay, and then last about being afraid to take that step to get started is thinking that all sorts of myths out there are fact. And welcome to my world. I talk about this ad nauseum, that a lot of people, especially if you ask questions in a public forum, such as a Facebook group, you have to remember that those people who are giving you an answer may not necessarily have the background to be doing so, and they don't have, a disclaimer that says, hey, I'm just giving you my personal story, or I'm giving you an anecdotal story. That's the hard thing, is people, they just don't know where to turn. They don't know who to trust, that type of thing, because they ask a question in some of these groups and somebody will give them an answer that's over here, and somebody else will give them an answer over here, and the right hand and the left hand don't make any sense. And so people are just paralyzed, and they say, okay, well, rather than make a decision, then I'm not going to do anything. Which kind of leads me to the next thing. So remember I said that there's two things my clients tend to be afraid of. And the second thing is making a mistake. So they have all this information and they don't know what to do with it, and they don't know who to trust, and they just do nothing. I always say that being afraid to make a mistake is the mistake, and so really what I wanted to talk about is those people who are afraid to choose the wrong provider, do things in the wrong order, and then choose the wrong therapist. So first, let's talk about the wrong provider. This happens all the time. I see people all over the world, and I do not get to assemble my dream team. So with that said, I always preach and teach to my students that having a good therapist, having adequate pre-procedure myofunctional therapy, doing post-procedure myofunctional therapy, doing all of those things can overcome a lot. However, I do have some clients that come to me and they have a frenectomy done and it looks like it's a canker sore. Now, I always say it's not about appearance, it's about function, but when that happens and we don't get a complete release, it's important to understand that. Finding the right provider. I have talked before. You can go back and look at my blogs. I know that I have a blog. I know that I also have a Facebook Live discussion about finding the right provider. You need to ask questions. You need to interview them as much as you would interview somebody for a job. You want to know, how many have they done? Do they work on adults? Do they work on babies? Just because a doctor has a laser doesn't mean that they should be pulling it out and using it on you. Just because your child is scheduled to have tonsils removed on Friday does not mean you need to let that same person do the frenectomy. Different specialties, you want to find the right person. So I feel like there is so much information out there, and there's so many people like me, a lot of resources available, that this is a poor excuse for somebody to not do something. It's going to take a little bit of elbow grease, but you have to dig in, and you got to look for that person and ask questions. Next, people being afraid to get started because they don't want to make a mistake of doing things in the wrong order. Sometimes this matters. This really does matter if I have a kiddo who is in expansion or they're going to be going into expansion. We can't do a frenectomy on them and expect that I can get suction. Because the tongue needs to be in the roof of the mouth, I need to be able to accomplish doing a suction. And if somebody has this big old obstacle in the roof of their mouth, that's going to impede the suction. So that really matters. But for the most part, there are a lot of times where we can get started with therapy, or somebody can at least get a plan. I start therapy 2 months ahead of time with my clients. So just because I do maybe want you to see your sleep doctor or have a sleep study done, that kind of stuff, those things can be happening concurrently. Having a tongue tie is an obstacle. So if I have a concern with somebody with snoring or mouth breathing, maybe some sort of sleep disordered breathing, we have to weigh what we need to do first and what has to happen in what order, because having a tongue tie and the tongue in the back of the throat is an obstacle, and it can be causing those issues. So we talk about that, and we talk about the order to do that. And last is the wrong therapist. This suddenly is just rearing its ugly head, and I feel like I'm talking about this a lot. And people say, I've already started with somebody and I've already put money into it. Who cares? In the big picture of looking forward at the rest of your life, getting successful therapy, finding somebody who is a good match, start over, find somebody else. If you're working with somebody who doesn't feel like they're giving you what you want, if you're working with somebody who does not have a step-by-step framework, who does not have a plan for you, every person that I work with has a step-by-step framework. I have a plan every single time I go into work with somebody. It doesn't always end up that way because we have to make changes as we go, and I have to customize that and see where you are and what you need. However, I do start with a framework. And so if you're working with a therapist who's just, doing this exercise and this one sounds good, ask questions. If you have a gut feeling about something, do not be afraid to get another opinion. I'm having people coming to me with second and third opinions, and they're just really, really frustrated. So don't be afraid to not get started because you're afraid of not having the right therapist, but do your homework. Make sure that it's a good match and that you ask the right questions. Okay, so I think that just about wraps it up. Next week, I am going to be talking about what can help you right this minute. Okay, so going to be kind of fun. There are also some tools. So when I talk about a step-by-step framework, each week I also talk with you about a couple tools that I have out there for you that will help you get information before moving on. That first one is a quick assessment. So if you don't want to talk to me or somebody like me right away, you want to kind of do a little bit of me search, then you can, let me put that up here so that you can go to the bottom of any blog. There you go. So the quick assessment tool is going to be 25 questions. And these are the biggies. These are the ones that I'm going to talk about with you when we do your comprehensive exam. So it's a great place to start. You can also start with a free assessment. That's going to give you a chance to meet me, make sure we're a match, see what it's like to do online therapy, because I do 100% of my therapy online. So that's a great place. It also gives you a chance to ask questions and make sure that it makes sense for you to move on to a paid comprehensive exam. The other tool is sleep tools. So you can download those. You can find them at the bottom of my blog. Last and not least, I ask you guys this all the time. If I educate you, I teach you something that's useful, share it. If you know somebody who needs to hear about snoring, if you know somebody who has a terribly loud swallow, that is going to matter as they get older, lose muscle tone. Then we start to see more problems with choking. So share it. I have the tongue tie and myofunctional therapy support group, so you can join that, and then you can also find me on YouTube. So thanks so much. I will be here next week, and I'll see you then. Bye for now.